Hi, Donald and Shira Scroggins. Put together today and today I'm going to have a quick chat about hay fever. Hay fever is a type of allergic rhinitis caused by pollen. It's a condition where an allergen makes the inside of the nose swollen or inflamed. It affects the nose, sinuses, throat and the eyes, causing sneezing, runny nose and itchy eyes. Most common in spring and summer, however, people can experience their symptoms at different times of the year depending on which pollen they're allergic to. Often a useful tool is paying attention to the weather forecast, especially this time of year where the pollen count is usually indicated. Hay fever symptoms worsen if the pollen count is high. Pollen count of greater than 50 indicates high, so pollen count is the number of grains of pollen in 1 cubic meter of air, so there's low, moderate and high. Best way to control most allergies is to avoid the trigger substance, however it's difficult this time of year when the pollen is in the air. Allergic reactions, so symptoms occur when the immune system overreacts to a normally harmless substance, in this case pollen. When the body comes into contact with pollen, cells in the lining of the nose, mouth and the eyes release a chemical called histamine. This triggers the release of an allergic reaction, symptoms of allergic reaction. So 20% of people are affected, can often be associated with asthma and eczema. Antihistamines are usually the first line of treatment, so they block the action of the chemical histamine, preventing the symptoms of allergic reaction. So they treat itching, sneezing, watery eyes. Different decongestants can be used for the nasal symptoms, so they decrease the swelling of the blood vessels in your nose, which opens the nasal passage and helps to make breathing easier. They're not to be used for more than 7 days, as using them for more than this can cause dryness and irritation. Different steroids can be used in the treatment of hay fever because of their anti-inflammatory effect. When pollen triggers an allergic reaction, the inside of the nose becomes inflamed, so steroids can reduce the inflammation and prevent the symptoms of hay fever. These can be more effective than tablets, preventing and relieving nasal symptoms. They can also relieve itching and watery eyes, where they're most effective if started a couple of weeks prior to symptoms developing and continued for used regularly. Different eye drops can be used for reducing of redness, irritation, redness, wateriness. Drops often contain an antihistamine which reduces the inflammation in your eyes, which helps to relieve the symptoms. Another handy one is just a little barrier, so you just rub a small amount around the nostrils and the bones of the eyes, so that it helps to trap any pollen that comes into contact. Agus sin gacrad.